Great. Hello, everyone, and welcome to this webinar on data governance for digital social protection systems. So I'm very glad to be the one who's kind of hosting you and moderating today. This is a webinar that we've wanted to do for quite some time, and the underlying product, the report, the guidance that kind of sits behind this webinar has been much desired for many years. I don't know how many times in trainings and conversations we've said data governance is crucial. You need to get it right, especially for this sector. But we as the Digital Convergence Initiative hadn't got to the point where we'd been able to fully articulate exactly what that would look like, kind of what an overarching framework could look like for data governance. And as metaphors are useful in this world, I was looking for a metaphor that could help us. And we obviously all know that social protection requires a large amount of data to do what we do. And I was reading a report from Segovia University just yesterday on data policy and kind of how we could be reaping kind of the benefits of data more systematically across sectors. And one of the sentences that hit me was data being like water. It's globally abundant, but very often siloed, locally scarce, and badly used. So I'm going to just hitch onto that water analogy, just thinking of kind of the data governance as the systems that we need in order to deliver water to the right people. So the pipes, the people, the safeguards, the processes, the maintenance, kind of everything that kind of needs to happen to make sure that the water is clean, that it's reaching the right households, it's kind of safe and reliable, it's not going to contaminate us, and kind of it's not going to leak. We're not going to be not reaping kind of the most from it. So with that silly analogy, I'm going to kind of move on swiftly in terms of pushing us towards how we're going to be doing this webinar. As always, with socialprotection.org webinars, any questions, please put them in the Q&A box. So if you want to kind of add any comments or kind of share any resources, or if you'd like to introduce yourself, please use the chat. And kind of you can use the everyone function kind of if you want to be seen by everyone. But for questions, please use the Q&A box. Simultaneous interpretation is available in multiple languages. We have English, French, Spanish, and Portuguese, so you can choose the right channel and tune into that. And this session will be recorded also for future use. If we go to the next slide, the flow of the session is going to be quite simple. We have this welcome and introduction. We then have 3 different presentations, and I'll be introducing the people who we have with us in a second. And then, to be honest, I kind of see quite a bit of merging between the discussion and the Q&A. So just start the questions flowing as they come to you so that we can integrate them really into this second half, which we hope to have kind of quite a significant amount of time to be doing this. So let's come to who we have with us today. So we have Tim Ollenberg as our lead presenter. He's the author of the publication from the Digital Convergence Initiative on data governance. And kind of he's been kind of bravely and boldly being the first one that kind of articulates what we'd all been saying for so long into a document that actually kind of conceptualizes that and pulls it all together, drawing on a huge amount of resources and drawing on work that he'd previously done in Rwanda. We also have 2 of our champions for DCI. They've been working with DCI for many years, even before DCI was really formed. So we have Veronica Acha, who's head of the Social Information Division in Chile, and Ercan Dansuk, who's within the Ministry of Family and Social Services in Turkey, is the General Director for Social Assistance. So welcome to both of you, and we're really excited to be hearing from your perspectives kind of how all of the work that you've done on the data governance side has really enabled you to go far beyond your typical use cases for a social protection information system. And I'll be your moderator today, and I've also been collaborating with the Digital Convergence Initiative for some time. So if we go to the next slide, just to give you a little bit of background before we dive in, for those of you who don't know the Digital Convergence Initiative, I doubt it, but just in case, this is a joint effort by USP 2030 to support the digital transformation of social protection systems. It's coordinated by GIZ, ILO, the World Bank, Expertise France and FIAP and others, and kind of has a range of funders. And we've been broadening collaboration in a partner forum. So probably a lot of you have been involved with DCI in some shape or form in recent years. If we go to the next slide, some of the key activities that kind of underpin how DCI works, you can see here on this slide. And they're all kind of hinging on the concept that we don't want to be reinventing the wheel. DCI wants to be facilitating learning across countries and kind of really leveraging what we already have to do better and to do it in a kind of ethical way with kind of strong safeguards around it. And we've been learning from Turkey and Chile a lot kind of over the past many years. So you can see here a knowledge sharing pillar, and this is a kind of a way in which DCI facilitates a process to create knowledge products based on demand. Do go and dig on the website. Obviously, the data governance document is kind of one of the key resources that we have, but there's several others. And there's a few also in the works. So just to give you a sneak peek, there's one kind of forthcoming on cross-border portability of entitlements and how data exchange can be supporting that. There's a forthcoming document on integration between disability registries and social protection information systems, really digging deep into kind of how that can bring benefits to all sides. And the AI hub within DCI is also producing a suite of foundational products on the role of artificial intelligence in social protection and risks and safeguards mitigations for that. There's the pillar there on global technical standards is a crucial one for DCI. There's many technical standards that have already been developed on integration with disability registries, with civil registration and vital statistics systems, with social registries, integrated beneficiary registries, farmer registries, and ID systems. There's more forthcoming. And the effort here is to really harmonize those technical standards and for countries to be adopting these to kind of better support interoperability across different systems. There's a strand of country implementation support just to make sure that the knowledge isn't generated just for knowledge's sake, but actually is being embedded in practice in how countries are supporting digitization, and same for the technical standards, and similarly a capacity development and training focus. So if you want to know more about DCI, just do some digging on the website, and you can also contact kind of the info email, and someone will be in contact. Having said that, let's jump into the topic for today. So we're going to be introducing the data governance framework, and I'm going to hand over to Tim. As I've said, Tim is the lead author on this document that we're sharing with you today. Over to you, Tim. You're still on mute. I can see your, Tim
Yes,
has
thank you very much. I just said, looking to.
Great.
Look, here I am. Hello. So thank you all very much for joining. That's great. As Valentina said, this has been a long time coming, and we're excited to finally present this work. Also, as she said, that I was bold to that reminds me of my first days working in macro consultancy, which is basically forecasting the future, right? And my boss convinced me in that first week to write a piece that Greece might leave the Eurozone, and there were more headlines about me making a rash prediction than anything else. So I hope this will turn out better. So let me give you a quick overview over the report. So basically, data governance is a very wide field, and although it's widely acknowledged that it is something we should be doing, it's not immediately obvious what that really means, right? So mapping data governance to the social protection sector and being clear on how those broad principles of data governance apply in the sector and in what ways they relate to it and in what ways they are applicable is the core objective here of this report. So taking a somewhat abstract field and saying, well, in social protection, it means this. The aim here, of course, is to support policy reform and to promote better data governance in the interest of social protection beneficiaries, right? And our overall approach is to try and make it practical and give a level of detail and specificity that enables policymakers and practitioners to take that forward into a reform program or generally ways of improving data governance in the space. And we'll talk a little bit about how one might go about that further down. And of course, we also hope that it's useful for development partners in their conversations with policymakers in promoting some of these ideas and practices. It's of course only a starting point, right? So this is the first time that we've tried to say, what does data governance mean in social protection? How does it apply? And this is not a definitive statement, but it's also a journey in terms of defining it and mapping it. And of course, context matters tremendously here. It is bold because we're trying to say, what does it mean across any setting in such a diverse sector? That is, of course, rather ambitious. And I hope I'm not obscuring the text, by the way, but yeah, so obviously context matters, and we don't mean to say that this is the last word and always correct, but we hope that it's a useful starting point. So with that background, what do we mean when we say data governance in social protection? So we've tried to break this big field down, first of all, into 4 pillars. So taking data governance as one field has different pillars, and from these pillars we can then define building blocks that make up those pillars to stay with the building analogy. And these can then in turn be implemented in specific ways, right? So for example, if we take data quality, it has different dimensions of data quality, and such as completeness and accuracy. And these can then be implemented in specific ways. The report that we obviously encourage you to look at and hope you find useful presents that information in summarized terms and goes into even more detail than we can discuss today, also looking at specific tasks and responsibilities. But yeah, in the interest of time, we will skip over that level of detail. But it's also not something necessarily to read cover to cover, of course, but as a starting point for review and consideration. So the 3 levels we will discuss today are the pillars and the building blocks, and then we will just show you the implementation mechanisms, just to give an idea. We could speak much longer, but I think it'll be more interesting to hear from the practitioners, and for that level of detail, please do consult the report. So what are the 4 pillars? Well, the first one is the management of data, and the guiding principle here is the data life cycle. So data goes from a planning stage, what will be done through acquisition, it's then processed to convert it into useful information that can be analyzed. Those results can be shared, the data can be used, and finally, when it's no longer in use, it needs to be archived or deleted. So that is the management cycle, and really the the operational aspect of it. Another important aspect is data quality. So the different procedures that make sure that data meets those quality criteria, and I'll briefly talk about those after. Data access is the third pillar, which is really essential in this area where we have a very broad sector with many institutions and many players, and also obviously so many people who have very sensitive personal information in that system. So the right access controls are essential. And then finally, there is the security aspect that is an obvious essential part of data governance. So let me briefly show you these pillars one by one. So starting with management, as I said, the guiding framework on this one is the data lifecycle of planning, acquisition, processing, analysis, up to archiving and deletion. And these aspects, for example, let us take the acquisition part. So here, data is acquired in different ways in social protection, often from other public bodies, right? So data sharing agreements between public institutions are an important part. There is primary data collection, so the design of the registration form and the processes for acquiring that data, which can be summarized in a data acquisition policy. Those are really important aspects of correct and solid data acquisition. And in the report, we will then say, what does each of these mean? What tasks are involved in implementing them, and taking stereotypical roles of the space, such as system administrators, data collectors, policymakers, and so on. Who should be doing what in order to implement this? Again, as a starting point, not as a worked out plan, but to start planning, or whoever wants to say introduce a comprehensive data acquisition policy or the like. So there are so many aspects here that we cannot discuss them one by one. It wouldn't be very interesting, or take a lot of time. So let me just move through so that we have more time for discussion after. And again, please consult the write-up to get a sense of the level of detail that is there. So data quality, of course, as you know, for a digital system, there's the old adage that garbage in, garbage out. So if you do not have quality data, then the outcomes of your digital social protection system will be lacking and will be not in the interest of beneficiaries and not meeting policy objectives, right? So complete data that captures everybody, accurate data that makes sure that the information is correct, current data that is about current living conditions and situations of applicants and beneficiaries. Consistent data, there are often many parallel programs that the data be correct across the entire system, that it is stored in the right formats that the digital system can consume, and of course, at the end of the day, that we ideally have one record per person, per beneficiary, to avoid many of the inaccuracies and so on that often arise in parallel digital systems, are aspects of data quality. And here below you see core examples of how those building blocks can be achieved. The third pillar is access. So this is not necessarily a standard pillar or aspect you will find in any data governance framework, but we felt that in social protection, this is especially important because there is such an incredible amount of sensitive information in these systems that needs to be access to which needs to be controlled, and access to which also needs to be created, right? So there is the element of access control and making sure that the right people only the right people that have a reasonable need for that data are able to access the data, but also that it is shared in a way that facilitates the operations of the system, that allows updating of information, and that goes towards having a dynamic digital system that of course is a key overall policy objective. And beyond that, being more open and sharing the data, so providing information to the wider public on their own data, but also in summary statistics and so on, is very important. So data access really key in this space, and thus merits its own pillar. And finally, data security is of course essential. You all know about this. I don't think I need to lose a lot of time on it, other than saying perhaps that the guiding framework here is the ISO 27000 family of standards, so a typical paradigm. And it's just, you can't admit it, but I think that there are reference documents exist, and so we have a little bit less detail here, as typically policies already exist. But this is basically just to double check that one's own data governance framework meets those core criteria. So yeah, that is very quickly the overview of the framework in terms of the pillars. And then given that we have, I think, well over 40 different implementation mechanisms, the question is, how do you do this? How do you work towards implementing these mechanisms? Can we get these building blocks in place? And so based on the experience with Rwanda, and I think this will be a work in progress, and we hope to iterate on this implementation as we get more uptake and experience from practitioners. But here's an initial suggestion of how to go about it. And the first step for it really is to convene core stakeholders, because social protection is a multi-stakeholder endeavor, and it is really important to get everybody on board early on and in the same room, because so much of these tasks really cut across the sector that it's important to motivate everybody and have a joint enterprise, so to speak. Secondly, scoping this framework, as I said, there are well over 40 items. Many of them may already be covered by national policies. There may be ones that are, don't need particular attention. There are others that may not be included here that do. And so getting right-sizing the framework in general is something to fit it to the local context. Then the next step would be to look at where, so status quo, where do we stand, understanding for each of the building blocks, how this can work, and what gaps there are to that. And that picture of gaps will then allow the planning process of prioritizing which gaps to tackle, because again, it's a broad field of as you saw, so many things could be done. You need to decide which ones, the limited attention and resources, both in management and financial implementation capacity as well, should be allocated to, and then probably implement that in a cycle that could be a 12-month cycle, say. And after that, go back and repeat that process in order to find in order to build and ultimately perhaps work towards a data maturity framework in that space. And we hope to get feedback and more implementation experiences as this is tried and rolled out. And I think yeah, it would be great. One idea is to put the framework up on the internet as a living document that can be commented on, that can be easily accessible online as well. So there may be watch this space in terms of future iterations of it. But yeah, so yeah, that completes my overview, and I pass back to Valentina. Thank you.
Thank you so much, Tim. And thanks also for kind of hinting in the background just some of the difficulties that we faced in developing this, and that you in particular faced. I was kind of supporting to some extent in a peer review role, but some of the tensions were around, obviously, kind of data governance is a topic that cuts across any sector. So what is specific to social protection? What is really crucial for social protection as a sector? Kind of was one of the key questions that we were trying to zone into, and then kind of provide links and kind of details to the broader framing, but zoning into what's useful for social protection specifically. And second, trying to be as universal as possible kind of when we're looking across all the dimensions, so that it becomes a bit of a checklist for countries to be kind of evaluating themselves again and finding further resources in this kind of process that you were describing, which means that sometimes the specificities of what kind of situations might be in countries are being lost, but the whole point is this being adaptable to country contexts and sort of groundable in those contexts. And if I go back to my water analogy, even though you're talking about building blocks, I see kind of the management pillar being the water authority that's kind of deciding where the pipes are laid and kind of controlling where the water is coming from, where it needs to go to, kind of planning, regulating, overseeing the system. The quality could be kind of about the water purification and testing, so making sure that it's clean, kind of the accurate, it's kind of fresh, so current, kind of et cetera, kind of along that kind of the value of kind of why water is important to us. The access pillar about being about the pipe, the networks, the taps, who is receiving kind of the water, kind of where at different levels, including public fountains, potentially kind of the open data element, and the security being about your kind of reservoir system, the locks, the kind of emergency systems if things go wrong. So I'm pushing that analogy a bit far, but sometimes metaphors help to ground things in our brains. So I've gone for it. Great. So thank you so much for giving us that overarching view. So now we go into kind of what does this actually mean at country level, and how has this played out? And Chile obviously is a kind of one of our favorite case studies, just because there's a kind of very advanced system to be looking at. And over to you, Veronica, to talk us through from your perspective.
Thank you, Valentina. Hello to everyone. I hope you can hear me well. My apologies for the music. Special thanks to the organizers of this webinar. Thank you again for their kind invitation. Let me talk about Chile's approach to data governance on the only ask once policy. Next, please. Of course, this very simple idea is only one part of a digital transformation policy. What the law says is that people have the right to be exempt from submitting documents that do not correspond to the procedure or that originate from or are in the possession of anybody of the state administration. In the latter case, the documents must be sent by the body that has them in its possession to the one that is possessing the administrative procedure. In simple words, if a government agency already has some information, another shouldn't ask for it again, but acquire information from the agency that has it, and through interoperability. This is not new. We had this kind of mandate long ago, but now we were ready to pursue this goal. Next, please. But how do we move from a statement to a reality? As I said, we already had this kind of statement earlier. We couldn't reach it. Next, please. For that, let me tell you the story of Ines. She's our favorite woman. Maybe with her story, it would be simpler, easier to understand what we are doing in Chile. Ines is a mother like anyone else around the world. She is 45. She lives with her mother and her son. Her family is in the 50% of most vulnerable group of the social family registry in Chile. She has a small business with low sales, and she used to supplement her formal employment income with her sales. So she used to work, have a formal job, and she also had this informal business, small business. But recently, she lost her job, the formal job, and feels overwhelmed. Let's see how the social protection system may help Ines and her family. Next, please. On this situation, she is scared. And the only thing she has today, besides the scared, is that she has the national ID number. The national ID number is a universal unique number in Chile. And she also has a digital ID number, Clave Única. Clave Única is currently covering around 2/3 of the population in the country. Is a password that we can use to connect to the public services. Next, please. Okay. Ines needs to understand if there are some help that she may have access to, or she's entitled to, or her family. But let me tell you something else about Chile. We have a high number of public funded programs, a really high number. Since every year they pass through an evaluation process, we know that in 2024, over 400 programs were directed to individuals, and a little more than 300 were allocated to other types of users. So without help from public officers or social workers, it's not easy to understand if you are eligible to a social program, because the entire system is very complex. But as I said, as we perform annual evaluations of the public funded programs, we also have some regulations to use personal data to help citizens and public organizations. So we also have the solution to this very complex social protection system. Next, please. This is the case of the Social Information Registry. This registry was created by law in 2004. Is a personal data bank administered by the Ministry of Social Development and Family, the place where I work. And it's here the data is connected to the unique national ID number that I mentioned earlier. Also, this registry includes the family registry, the integrated social benefits, and other relevant pieces of data, as you can see here on the diagram, such as information from the civil registry, vital statistics, some assets, some income, health data, contact information, more data. For some of these pieces of data, we have over, for example, on at the level of the social family registry, over 84% of the population in the country is part of that registry, and on the integrated social benefits beneficiaries, 90% of the population is there. RIS interprets with many public institutions with which we have signed and detailed agreements determining cybersecurity rules, which kind of data we are going to share with the organizations, which data is included, this interchange between organizations, the interoperability mechanisms, and among other elements. RIS is managed by a team where data governance and cybersecurity practices are in place also. So, as you can see at the right part of the slide, many of the elements, all of the elements, I would say, from the model that a team was presenting earlier, must be in place to manage this kind of registry, because you have a big responsibility in terms of the amount of information that you manage about the population of your country. Next, please. As I also said, Chile is implementing a digital transformation law. And this is a progressive path that started 2022 and should be fulfilled by 2027. This is not something that happens from the morning to the night. Besides, they only ask once policy. There are other goals, such as to promote that a complete cycle of the administrative procedure must be carried out electronically, and to provide greater certainty, security, and speed in the delivery of services to the public, along to greater transparency in the state's processes and actions and the relationship with the citizens. So this law mentions that we need to provide and properly use electronic platforms for this purpose. And we need to use standards of security, interoperability, interconnection, and cybersecurity. Next, please. The key aspects of the state's digital transformation law are digital communication, data notifications, administrative procedures, electronic files, document digitization, and interoperability. Every public institution in the country has to follow a plan, develop and then follow a plan, an annual plan, to reach the goals by 2027. Next, please. This is how we may find out if there is support or assistance available for Ines and her family. So, because the one-stop shop for social benefits that connects all of the above elements is the way that we find that we created using all the elements that we have in the country to make it easier for citizens to navigate the very complex social protection system. Next, please. So let me show you Ventanilla Única Social. We created this one-stop shop for social benefits. We launched it last May in 2025. It allows citizens to connect with over 130 procedures, benefits, and social services from different institutions integrated into a single platform. Also, it helps identifying direct eligibility for over 100 benefits using the administrative records available at the RIS, the information, social information registry, and through interoperability with other institutions. People only need to log in using a personal password, clave única, provided by the civil registry. Next, please. So once Ines logs into Ventanilla Única Social using her clave única, the Ventanilla Única Social presents information tailored for her and her son, and also it shows some information about her mother as part of the same family registry. Therefore, they can update their social registry of households if needed. Next, please. This is how, this is the kind of information they can see. Of course, the information depends on each person, each family, because the details are tailored for the user. If Ines, for example, is part of the public health system, for Ines and her son, they will find some important notifications about vaccines or some relevant health controls if they are late with some checkups. These are some examples of the only ask one policy. If I validated her identity through the clave única, I would already know her sex and her age. Also, through interoperability with the Ministry of Health, I could know which medical exams she would have had done in the past 2 years, if any. With that, if she didn't, I could give her a reminder that she needs to take those exams. Well, this and more is available on Ventanilla Única Social, but time is running out. So thank you very much. Back to you, Valentina.
Amazing. And the beauty of speaking to you, Veronica, and your Chilean colleagues is every time we speak to you, there's been some new feature added to the system. And again, building on a very solid data governance foundation. And even this new law, obviously, you're speaking to the fact that sometimes it goes beyond the sector. This is looking across all sectors. And we're looking at a much bigger data and digital transformation strategy. But what the implications are for the social protection sector are very specific, and we need to be thinking about those. And again, when we're looking at our own data governance, we need to see how it relates to these broader processes which are happening kind of across the whole government ecosystem. So thank you so much for bringing that alive also with Ines's example, and the Ventanilla Única that actually translates literally to single window, which is a concept that the ILO has been talking about for such a long time, and the obviously translated also as one-stop shop. Great. So thank you so much, Veronica. I'm going to hand over now to Ercan, who will be looking similarly across our kind of different pillars of data governance and what these have meant and what these have implied in Turkey. Over to you, Ercan.
Yeah, thank you, Valentina, and thank you for all the team behind the organization of this webinar and all the institutions. And I will send my greetings to all the participants of this webinar. Yeah.
Paula, it's you with the presentation.
Yeah, Paula. Thank you, Paula. I am from the Turkey Ministry of Family and Social Services. I have been working on the social protection more than 30 years. So what I talk about today is the stories, the challenges, the problems when we were establishing the social assistance information system in Turkey. Next slide, please. Uh, more years ago. Yeah, we have the one of the first example of the integrated system of social assistance in the world. And when we start to establish this system, there was no such a example for us. So what we did and what we learned by what we learned we learned all the things by doing. Yeah, integrated social assistance system information system is a software program and enables the collection of the supporting documentation for social assistance application to be completed automatically online. It's what we have created with this system. We create an efficient, fair, and responsible social protection programs, and we have also created an interoperable administrative data and local verification and strong safeguards. And also, it provides this system provides aligned with the protection of the data, public administration standards, and international best practice. Go on, please. Next, yeah. When we started to establish this system, one of the big issue was the data governance. And first, we have created a data management plan, so to cover what kind of data we need, what kind of relation with the institutions, and what kind of relation with the systems, the data systems. So in that plan, we defined the indicators, data, and we created lots of the protocols with the institutions to cover the roles and responsibilities of the institution. And also the most important point was the data dictionary, creating a data dictionary. You know, most of the many institutions have the databases, but they have different format. They can use the different IT infrastructure. So by creating a data dictionary, we have created a standardized data formats, and by doing this, we can easily convert the data into the operational formats and standardized, validated, and usable formats. And we have created many interfaces among the institutions and our ministry. With that interfaces, we can automatically use these data, and also in the sharing process, in the sharing use process, we have defined who uses these data, who use this system, and our data base includes three main sources. administrative data from the different institutions. Household visit is very important, and self-declaration. And by combining these three data sources, we have created a social registry. And another issue management of the database is the analysis. And for monitoring and evaluation and policy design, we have created metadata and the data catalogs, and also data protection impact assessment. And also we need to define the how we manage the data, and how we enter data, and we use through the retention schedules and secure disposable access, manage the end of data life cycle through the defined retention periods aligned with the legal, operational, and audit requirements. And yeah, let's go to the next slide, please. Yeah, as I said, these are the first step of the data creation of data. And when an applicant come to us with and we have a administrative data about applicants, and then we combine these administrative data with the data from the fields, and then after the assessment phase, we enroll these data people by using the different testing, and at the end we create auditing and data analysis and beneficiary monitoring processes. After all processes, we have a payment list of our beneficiaries. Yeah, let's go to the next slide. These are the main procedures. Yeah, as I said, how we get the qualitative data for our beneficiaries. Yeah, especially we have created at the beginning, we have created standardized minimum data sets from the different institutions. And we get all the data for the beneficiaries from administrative data and all the household visits. And we have fully, we get the full information about the people. And also, with this data is not a static data. We can automatically, our system is automatically control the all data for our beneficiaries. Our system automatically connected all the databases of the different institutions. If there is any change in someone's position or the data, this system automatically sends the changes to our system from, for example, Ministry of Health to our system. And we can after collected collection of the data, we can easily design the indicators aligned with the social policy objectives and periodic reviews of the eligibility criteria. And Also, for the accuracy, we 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 trained our staff and the social workers. We change the data collection. If there is any change in data collection standards or verification practices, we give the continuous training to our staff. And also for consistency, we create a uniformity among the records and the databases by using the different techniques, as Tim said, computer-assisted personal interviewing, and we use the such tools to get the consistent data. And also uniqueness is very important. I think we use the national identity number for every person. With that unique identity, national identity number, we create a uniqueness of the data, because when you enter when you apply anything in public, you can use this national identity number. You can get all the services with that number. Yeah, go next, please. Yeah, this is just the slides for the gathering data, and we have two dual gathering information data process. One is at the central level, we can create the administrative data of the applicants, and at the local level, there are more than 1,000 local offices in our system. In every district, they can check all the data, all the information about the applicants by the household visits. And after the application, we standardize declaration-based data, and we integrated this data with the different databases and verification. So after combining these different kinds of data, we create a full information about these applicants, and also we get the consent from every applicants to review their information. Next, please. Yeah, these are the how we get the administrative data. We had lots of protocols from different institutions for social insurance, for Ministry of Interior, Ministry of Health, Ministry of Education, and by getting these data from the different institutions, we create a civil registry and the social registry of the applicants, and all the institutions are part of the e-government system. You see at the center, they are part of the e-government system, e-government portal. We can our system easily use this portal to get all information from different institutions. Yes, next, please. Yeah, our system is not static, as I said. It's a dynamic, and we automatically update all the data sources. Our system updated all the data sources automatically with using the different interfaces, and a very high interoperable combination and connection among the institutions. That's why, yeah, ISAIS is a integrated social information, social integrated social assistant information system. It's the uh, short term of the our system, and we use a different administrative data sources, and as I said, to create a dynamic data, we especially household visit is very important to create an qualitative data and any changes in data, and we visit all the household at least once in a year to check if there is any change in the households. And we also use many programs for eligibility at the and benefit levels. So we check all the beneficiaries for if there is a changes in their conditions for eligibility and benefit levels. And yes, let's go to the next slide.
Yes, I was going to give you a bit of a time warning there. So
Okay.
yeah,
Okay,
fantastic.
Valentina. Yeah, access. We can. There is three kind of access: internal access and the public access. ISAS can get all the databases from the different institutions, and also the other institutions can get our databases, can reach our databases, and in a limited terms, people can use our system. The beneficiaries can use our system. Yeah, next slide, please. The security one. Yeah, there are many different measures for the security because ISAS, our information system, is the one of the maybe the only integrated system in Turkey that it includes the last of the private information. Therefore, security issue is very, very important. So when we work with the different institutions or the public institution, we have some protocols, security protocols with the institutions, and at organizational level, at technical level, at physical measures. So as said at the beginning in the management plan, we defined all the roles and responsibilities of the organizations, institutions, staff at the beginning. Therefore, all people, all staff, and all institutions knows how they reach the rules of the using the data and how they reach our databases. So there are many protocols and agreement among the institutions. Yeah, I think the last slide. Next, please. Yeah, these are the main system of the main framework of our system. Yeah, we have three levels of the system: citizen level, district level, and central level. I am in the central level. As I said, we have three different data from self-declaration to household visit and the administrative data. I don't give the details of these uh, slides. After the combining of these three data, we create a profile, household profile, and then with that profile, we use the different testing for the household, and then after that testing, we decide the eligibility of these applicants. Then we create a payment list, and with that system we follow and we monitor all our beneficiaries if there is a change their positions and their conditions. I think it's okay
Thank you
from my
so
side,
much.
Valentina. Maybe I used a little bit more
Don't
time.
worry. You went slightly over, but we're okay. To be honest, again, I mean, in both of your cases, just what you're speaking to is how when a system kind of increases in complexity, also in terms of the number of benefits that it's kind of releasing to different population groups and services, and that complexity requires a framework that supports it. So again, if I'm going back to my water analogy, it's not us kind of in a little village next to a stream and we're just picking up the water and boiling it next to the river, and that's okay. When you have more complexity, you need systems, you need institutionalized processes, you need these to be written down in guidelines, in manuals, in policies, in legal frameworks, and kind of that's what we're looking at here. And you've really spoken to across the four pillars of the data governance framework that DCI developed, kind of you're looking at how that has been operationalized in Turkey. So that was incredibly helpful for us. And you also, one thing I'd like to highlight is you mentioned the role of staff and people and individuals, because this only happens and comes to life when we're also training the people against these different policies, when they're kind of able to perform their functions following some of these guidelines that we've developed. So the role of that training component kind of is, and the capacity side is also fundamental. So what we're going to be doing now is I'll integrate a bit of back and forth between the audience questions and my questions to you. So let me start from the audience, and there's a combination of some clarification questions and some kind of questions. So there's one question from Patrick on when it comes to interoperability between programs, what framework should we be using to define which individual data can be shared, and if that individual data can be shared, which part can be shared, kind of what is shareable, basically. Happy for any of you to come in on that one. We have Beatriz asking about levels of anonymization and pseudonymization within a data strategy and kind of what you're doing for that. So these are actually quite linked, these two questions. And she also has a question on AI solutions, whether you're using any to kind of analyze your highly sensitive information. I'm going to skip your third question, Beatriz, for now, because with the AI Hub, we're also looking into this, and I think we can go into further depth when we're looking at those products. There's also a question from Ying on, this is a clarification question on what does it mean that the application standardizes declaration-based data? So obviously you have the data collected from people, and then you have a standardization process through interoperability. So I think that's to you, Ercan, if you could just clarify a little bit further on this standardization process. So let's start with those three, and then I'll come to mine. And if you have other questions, do keep on adding. We have a bit of time. Over.
Valentina, maybe I may go with the first
Please,
one.
go for it.
Yes. At least in the case of Chile, what we do is that we study the regulations, the laws that mandate the institution that is asking for data, personal data, to see if they have the rights to ask for data from people, because we need to ensure that they are entitled to have access to that kind of data, personal data. After that, when we have to answer, the principle is minimization. We send only the less the minimum piece of data that answers the question that they have. Sometimes it's a yes or no. They do not need the entire piece of data, all the file, the profile of the person. If the yes or no answers the question that they need to follow the process, the procedure, we only send that piece of data. And that's very important because we are updating our personal data standards also at the level of the European Union. So for us, it's very important that we are taking care of the rights of the people on this context.
Great. Tim, Ercan, did you want to come in on those questions?
Okay. Okay. Thank you. There are several questions about the. Let me start with the standardization. Yeah, standardization of data is very important because the institutions' databases are not the same. They use a different digital techniques, different digital infrastructure, and different codes for data. So that's why we need to standardize all the data set, the database in just only one format. So we use some protocols and some interfaces to standardize these databases. So standardization is very important. Is another yes, we use some. We have just started to use the AI solutions in a limited terms, maybe, but we plan to use the AI solutions in developed manners either this year. Another question is that ISAS, our social assistance information system, is a social welfare program, not just the health. It covers almost 60 social assistance programs, including the health, education, disability, refugee programs, and there are many family programs and the women programs. It's a social welfare programs. Yeah, we another question about the social assistance. Social assistance. As I said, we have 60 programs, and in that we provide the cash assistance to the people. It changed from the $10 to the $200 US dollars. We have two main programs: regular programs and the irregular programs. And we in our system there are 4.5 million households, and 2.5 million households are our regular beneficiaries. Approximately, they get $100 per month a regular cash assistance, and the irregular program is changed according to their vulnerabilities. And
I'm going to keep you focused on the data governance dimension. So the ones regarding maybe the system in Turkey, you could write in the chat.
Okay, sorry.
No, you were answering questions. You were doing your job.
So, yeah, anonymization. Yeah, normally we don't share. We don't give any private data to anyone, any institution. When we share our data with the different institution, we anonymize the people's information. Otherwise, it's not. It is forbidden to share any private information with the other institution. Yeah, I think this this is okay from my side.
Fantastic.
Oh,
And I've put in the chat, there's another kind of implementation guide that kind of it precedes DCI, but is DCI endorsed about good practices for ensuring data protection and privacy and social protection systems. So we'd recommend taking a look at that as well, kind of in the process. Tim, did you want to add something before I went on to my questions?
I mean, I'll just make it very brief. I think the sort of the principle of least privilege is important, that you should share only as much information as anybody needs to fulfill their official duties and no more, right? And so the default should be no sharing unless a case is made for any particular item, variable, as little as possible.
Fantastic. And with kind of informed consent built in from the start as well, which is something obviously that kind of should be there in the initial part of that data lifecycle. Okay, great. So I'll obviously go back to the chat and to the questions in a second, but in the meanwhile, let me just ask both Veronica and Ercan a sort of background question, because obviously you've spoken either to specific use cases or to what your data governance kind of looks like now. But I wanted to just for you to give us a bit of a sense of the trajectory. How long did it take you to get here? What were the stages? What were some of the most difficult parts to achieve? Kind of if you could just give us a bit of that sort of timeline idea of how this has gone. Because obviously some countries might be thinking, where do I even start? This is complicated, kind of that there's no way I can get there. So let's encourage them a little bit. Let's start with Veronica.
I would say that this is not an easy task. Maybe the maturity process. Maturity is the magic word. For us, it took a long time. We have been working on this for 20 years. I hope that for others it may take a shorter time, because now you will have more material to work on, because we didn't have that at that time. What I think it's very useful and has been vital for us is to have laws and regulations, very clear responsibilities to be accountable, to really understand the boundaries, the limits that we have in terms of what we can do and what we cannot do in terms of personal data and who's responsible for what. And of course, we need every organization needs to have to be prepared in terms of capabilities. This means people, enough or prepared people to perform their right at the minimal level processes. To have some technologies, you would need some technologies. If you build them from the scratch, or if you buy them, so now you have open source technologies to work on our sector, working with the standards, DCI standards also. So maybe it's easier now than it was earlier. And also, since when you're not working by yourself, when you need to be part of an ecosystem, it's not only that you are able to handle or that you have the maturity level, but what happens with your counterparts. Because if you're not alone, you need to deal and you need to integrate with other institutions that need to be at least at the same level or not too far from you. And sometimes that is not easy. So maybe that's a difficult part. When you are by yourself, when you're alone, you're the only one, so that is easy. And this was a step-by-step process. So I would say don't be rushed, don't lose patience. Some key points for us have been to identify the quality measurements for our data and for the data that we receive from other institutions, because many times when we work with administrative records, those pieces of data were not prepared by us. We receive those data sources from other institutions that were thinking on their own processes, and we receive those data sources with many issues in terms of quality, and we had to understand that data and to measure the quality, sometimes create documentation, adequate documentation for us to understand the problems, the issues, what the meanings of the data. And also, it was very important for us to be responsible and accountable about the use of the personal data to create some forms to make traceable what everybody was doing with the personal data every time. I would say that.
Fantastic. And I love that you said it's easier for you now. And I think we are in a situation where we can build on the shoulders of giants. And
Yes.
some kind of many countries have been sharing the processes, even the documents, kind of how they've been addressing things. We can build on that. So let's, I mean, as Veronica and Ercan have become core partners for DCI, other countries can be doing that. And that peer-to-peer exchange is sometimes even more valuable than some kind of guidance document. So let's kind of foster that and continue this process of fantastic. Ercan, over to you.
Yeah, I remember when we have started in this digitalization process in '99. Yeah, it took about more than 10 years to create such a digital or integrated information system. Yeah, the main problem was people, institution, and the citizen. They didn't know the digitalization. So uh, especially institutions didn't want to share their information with the other institution. It was new to sharing. Yeah, there was no such a word interoperability in that time. Sharing, just sharing. So 10 years later, we start to use the word of interoperability, and the institutions have seen that sharing information is not bad thing. So, and also when they if you don't have any understanding the sharing your data, it means that your data is totally different from the other institutions' data. So they don't know their formats of the data. They didn't know this. It was very difficult to create such a
That data
interoperable
dictionary you were talking about,
data.
just the process.
Yeah. Yes.
What do you mean?
Yeah. It was very difficult to. After we solved this kind of problems, we have started to work easily with the institution, especially the human factor and the institution factor was the very big problem for us.
Yeah, and there's the usual data being power, so resistance to be sharing data. And that's why sometimes a mandate that comes from above, a law that says you have to be sharing, you have to be only asking data once, as Veronica shared.
Yeah. Even if we have a legal documents for sharing the data or the defining the responsibilities, the institution and the people still they didn't want to share their data even if, but now it's easy. It's easy for us, for the institution, to work together to share their knowledge and data now, because people now know, and they have they know what's going on in the system.
Fantastic.
Okay.
So I'm going to ask one last question, which is on the chat. And I think, Ercan, if you could answer the one by Mona on kind of whether there's also data interoperability with Zakat and with other civil society organizations, if you could answer that in the chat, in the Q&A chat. Well, I'll ask everyone this question by Patrick that's going a little bit deeper. So he feels like his answer was answered, but how do we cope with very large volumes? How a program B can access data on program A beneficiaries for enrollment eligibility, because this can't go through a manual process. And obviously, we've only got 4 minutes left, so I'm going to just quickly ask one question for Tim as well, and if you can all be very concise in your answer. Based on your work kind of with supporting Rwanda, so actually kind of grounding this kind of more abstract framework in a country context, are there any lessons from that experience that you'd like to share with others, and any other broad cross-cutting recommendations you would have for countries developing a data governance framework that you haven't shared already? So we've got our last 4 minutes of discussion, so maybe let's start with Tim quickly, and then over to the others.
Thanks. Yeah, I think the most important thing, I mean, we heard that this is a journey, and it's a long-term process. And I mean, the UK, for that matter, has its own framework in terms of maturity, and they don't think they're there yet. No, it will continue. I think the important thing is to get started as a sector, and to bring the other stakeholders together, and not have just one core institution, say the social registry or so, lead, but really to treat it as a partnership, as a sector, and bring everybody on board, so that, because if you work together, it can be much more effective and much quicker than sort of isolated activities.
Great, and that's what both Veronica and Ercan were saying. Just get coordinating early across the whole ecosystem. Don't just work in your sectoral focus. Fantastic. Anyone want to answer the question on the how do we cope with those high volumes in terms of data sharing within a data governance framework, and guaranteeing the anonymization necessary and the data minimization necessary?
Yes, I would say that it depends on the specific problem or the specific situation. So in some cases, you are able to just perform the eligibility process online. So in that case, it's easier because you can be sure that the person who is applying for a specific program is enrolling, let's say, by Clave Única. So is the titular, the person, the real person asking to applying for a program that is asking to different organizations. So you can send the data and there's no problem, some specific pieces of data, and just prepare the infrastructure to be able to answer all of the people at the same time. But you need to be prepared. For example, in our country, we need to assess if we are going to receive 1 million, 10 million people in 1 hour or in 10 minutes, and to be sure that we will be able to receive that amount of people at the same time. Sometimes the process are not like that. You have time for people to apply, let's say, in 1 month, and at the end of the process, you need to perform some reviews about some elements, some requirements. So in those cases, we prefer not to share the data, but to receive the data from the other organization and cross all that information in our servers and send the the answers to the other organizations. So we don't have to share more data than needed with the other organizations. So it depends on the case, and that's how we handle this big amounts of data flowing. But all the time depends on the rules mandating each process. So we work very close with our lawyers. So we are very sure about the processes, the laws on cybersecurity measures, and that kind of things.
And the issue is they're not on an ad hoc basis. These have been sort of pre-assessed. You're looking at the use cases for each use case. You're understanding why does data need to flow from A to B, and what is the minimum required data to be doing that? Is it just a check? Are they already receiving another benefit? Yes, no, or is it more complex? So it's
that, we have agreements, signed agreements, so we already have an idea. So it's just unless if there's some new law with a very new social program, we already know what is going to happen every January, every year.
Yeah. Great. I think we're going to close on that. And it's showcasing that it's complicated, but it's doable if you have the right capacities and if you're thinking through things in advance and sort of institutionalizing them rather than doing them on an ad hoc basis, which is what data governance is about. So we hope that webinar was helpful to you from this perspective. We know there's a lot more depth in the document, so do go and take a look at that. If you have any suggestions also for improvements, as Tim has said a few times, it's work in progress, it's improvable. So do help us to kind of take it to the next step. A massive thanks to all of the panelists and to those of you who stayed on for a whole hour and a half to talk about data governance. Thank you.
Thank you.
Thank you, everyone.
Thank you very much. Bye.